Well, ladies and gentlemen, we move on to our first panel discussion of the day: hospitals and health tech, building better healthcare together. Healthcare is evolving rapidly, and technology is playing an increasingly important role in how care is delivered, managed, and experienced. But the real transformation happens when healthcare institutions and technology companies work together to improve patient outcomes, enhance operational efficiency, and make healthcare more accessible and patient centric. To lead this important conversation, we have with us our moderator, Sunanda Jayseelan. A big round of applause as we welcome her. Journalist, podcaster, media and crisis communication coach. So, with that, ladies and gentlemen, joining her on the panel are leaders bringing diverse perspective from hospitality leadership, healthcare entrepreneurship, wellness, strategy, and digital transformation. We have Dr. Karamveer Chabra, Executive Director of Alive Wellness Clinics, a prominent voice in aesthetic medicine and wellness. A big round of applause as we welcome him. A very warm welcome to you, sir. Joining us is Mr. Sunny Kichlo, Head of Strategic Business Initiative at Motherhood Hospital, bringing over 17 years of experience in healthcare strategy. A big round of applause as we welcome Mr. Sunny Kichlo. A very warm welcome to you, sir. And we have Dr. Ramesh Karmigam, Chief Operating Officer of Magnet Hospital, a healthcare leader with expertise spanning hospital operations, emergency medicine, digital health, healthcare strategy, insurance, and healthcare innovation. Once again, a very, very warm welcome to all our panelists and a moderator. Welcome to all of you. Over to Sananda.
Thank you so much to everyone who's here today in the hall. Thank you so much to the panelists. I'm excited personally to be really talking about the intersection about as far as hospitals and technology is concerned. I know we caught up offline and a few of you expressed that there aren't enough conversations when it comes to hospitals and the use of AI and technology. So I'm very glad that we're making this start, and I'm confident that there will be more such conversations going forward. We are, of course, talking about the intersection of hospital care, healthcare, and technology, and increasingly the use of AI. Now, before I come to that, maybe Dr. Ramesh, I can start with you and ask you to really talk about the fact that you're expanding, and you have this very interesting model where it is doctors and nurses who hold equity in the parent company, right? And my question to you is that you have some aggressive expansion plans. Now, as you're looking at that, how do you ensure that you're bringing technology in, bringing AI in to ensure you're standardizing really the scale of operations, you're standardizing really the touch and feel?
Asking me to share my thoughts here. Like Dr. Uma Nambiar ma'am was saying, I think nurses form the core or the most important manpower in the entire hospital space. So at Magnet Hospitals, we are acknowledging this. Usually when people think about hospitals, we just remember doctors, but it's far beyond that. I think 90 to 95% of the manpower in a hospital is non-doctor. If you look at non-clinical, it should be about 50-60%. So when we look at a hospital, we need to see beyond a doctor. And looking at that, I think doctors and nurses are the most important people. Not that we don't want to give consideration for the other key people in the ecosystem, but at Magnet Hospitals, we are looking at acknowledging this and trying to build the ecosystem around them. And now for India, not just in India, even in a global context, I think we have a shortage in terms of clinical workforce. It may be doctors, nurses, OT technicians, and there are different competency levels. In a class of 100 people, you have somebody at the top, somebody at the bottom. So you can't just say, I'm a nurse, I'm a doctor, in spite of us being certified. So one is there's a shortage of people. Second is there's a lack of clarity in terms of their competency. So when we are looking at a situation like this, I think tech can play a huge role in this particular aspect. So we also conventionally what we do is we have certain strong protocols. Hospitals are operation intensive ecosystems, highly operational intensive, 24/7. I think my colleagues here would agree. You know, we can't, it can be a Diwali, it can be a New Year, it can be anything happening. In fact, I remember we were running about 150 clinics across 18 cities, and there was a Kaveri or some kind of riot going on. Our entire team was sitting because we are doing a pan-India operations. The problem is in Bangalore. And then we left office once somebody told us that no, there was a firing and people were getting killed. So that's a kind of operation intensive business we are. So while
How are
we
you
put,
using technology to overcome some of these day-to-day
yeah, I'm
challenges?
sorry, I think I extended it. So conventionally, we were building in protocols. We were, strong focus on documentation, handover, etc., etc. Today, there are two unique challenges that we can solve where technology plays a big role. One is data, other is communication. So the data there, it sits across multiple teams, multiple softwares. If you can customize something to an hospital context where from inquiry to discharge, the data flows, and then again in terms of communication, the right people get the notification in terms of hierarchy, in terms of work to be done. I think automation and AI can help us to reduce the number of people, number of stylos, and that can help us scale. Today, for me to do 100 centers, I might need 100 people per center. But with AI and automation, I can reduce it to 80 people per center, maybe 10, 20, 30% reduction in the clinical workforce, but 30, 40, 50% reduction in the non-clinical workforce. So technology definitely will play a huge role, AI tech going forward, yeah.
Sure. Sunny, if I can ask you to respond to that same question, you are in a very crucial, even more crucial aspect of the healthcare piece, which is maternity care. And even as you are expanding rapidly, maybe you could talk to the audience about how you're using AI and technology to standardize your operations.
First of all, thank you. It's a pleasure to be here. Taking off what Doctor was saying, of course, when we are building a model which is easily replicable, in the sense that we are a maternal chain and fertility chain across women and children's healthcare, it's the touch point which they require in terms of their services. Uh, like I said, technology to us operators means different things. Like we all seen what sits across the data part of it, which is right now. Even in legacy healthcare organizations or even which are coming up, it is still at a stage where we are getting sort of hang of it, to be honest. Like Dr. rightly mentioned, the platform, right, the architecture, it isn't at a stage where we can deploy something which is more advanced, while we would want to do that. Second piece is on the business side, I would like to discuss, where a lot of our focus is on patient journey. While we call it as a journey, it ties back to the whole process of retaining that particular customer, because you acquire it at an X, and the entire thesis of LTV sort of ties into that. So I think the use case there can be much more specific. We see bits and pieces. We see a lot of the providers who come to us every now and then. I think I've seen a lot of action on the OPD very lately. I can vouch for that, because on the provider side, we see that as a problem. In fact, it's a black box, because imagine a scenario where a patient walks into a doctor's cabin. I think we do the EMR bit very right now. But what happens after that, I think that's where, as providers, we would want a lot more practical solutions. And I see that action happening a lot in the recent times. To my mind, if we can solve for that particular aspect from the first consult till you really want that patient to get admitted for some care they want in the hospitals, I think that's a big area for us to see. As providers, we would like to see that.
Sure. Dr. Karamveer, both Dr. Ramesh and Sunny really spoke about the positives of using AI when it comes to healthcare. If I can just flip that and talk to you about the fact that because of the access of AI, because of how easily now you can type in your healthcare questions into Google and do a Google search, does it become even more difficult in the space that you're in, that patients come in with maybe some answers, they're expecting, they're putting sort of, trying to put words into the mouth of doctors, if I can call it that. It's a very nuanced, fine line, right? Would you like to weigh in on that?
Yeah, so thank you for the question. The field that we are operating in is actually a luxury, not a necessity, right? So there's more of, and they're spending a lot of money on this luxury. So there's a lot of questioning, there's a lot of research that they do, especially with GPT models available, very easily. The only thing is that the models don't know, they cannot assess a patient. They cannot see it according to the personal needs of a particular patient, right? So we have to be very mindful of the fact that at the end of the day, if we are providing something to them, we have to listen to whatever their doubts are or what their questions are. And of course, it might be a little bit more, in terms of a task, explaining to them, but then that's our job. So yeah, for us, it's a little bit more difficult because of the type of space that we are in. But I think we're catching up with that. We have enough resources on ground to sort of help us with that.
I know I put you on the spot by asking you a difficult question, but if you can then talk about the areas that you're seeing in your line of work that you feel has definitely benefited from this use of AI, the use of technology, in some areas that you feel cannot be automated.
So I would actually categorize this into a couple of areas. One is that stuff that can be fully automated by AI. Then the second category would be that where AI can assist us or technologies can assist us as healthcare providers or doctors or even clinic staff. And the third area is where I think right now it's essential for human interaction or human touch to be present. So the first category of fully automating it is something like, marketing or in terms of scheduling of appointments, follow-ups, reminders, those kind of things that can be fully automated. Then second comes the assisting part, like what Mr. Thakur also said about scribing or, within a consultation, certain tools or certain AI technology that can help us, those can be used as assisting tools. And the final thing would be, of course, patient interaction, which of course cannot be totally taken away from the human touch. And that's where we have to be present. And we cannot rely on technology to give us a full-fledged and fully accurate answer.
If I can ask you that same question, yes, the obvious answers are, marketing, scheduling appointments, etc. But if you could drill down and talk to us, looking ahead perhaps into the future, what aspects of the healthcare business, particularly the healthcare that you're in, could be automated and what has to essentially remain and retain the human touch?
Absolutely, we're in the business of care. At the end of the day, I think the human interaction is you can't really replace. I think that eye-to-eye contact with your doctor, the nurse, I think that has to stay sacrosanct, if I have to say that. But where healthcare today is struggling is also on the manpower side. We understand, the shortages which are there, and some of that, if the technology can sort of aid. Again, we use this word very carefully because we never say replace. Probably it could be a bias sitting on the other side of the fence, but I think the reality today is that the good part is any of your relative who comes from abroad and gets a super specialty appointment in India at a fraction of an hour or so, it's a privilege today in this country. But at the same time, these same providers are also equally burdened with the kind of volumes they see in the day-to-day routines. If that can be a little bit aided by the technology, I think that is what we would like to see on the consulting side. And of course, coming to the nursing care, what we talk about, I think the ratios we all know sitting in this room, we would always want to have more nurses, but we can't afford it. Not that they can't be paid, but we know where the supply-demand mismatches. But I think a lot of that work can be automated to some extent in terms of the preparatory work before a patient actually from the OT comes into the ward and things like that. So there are many use cases. But of course, on the business side, there is definitely a big opportunity which we are sitting on. And while on the clinical front, there could be a lot of compliance-related issues which you'll have to navigate. But on the business side, it's a wide space today. I'm sure some of you are solving in terms of how do we bring in the predictability in the business? How do we get the models right in terms of our projections? I think some of these areas are really waiting to get disrupted, in my opinion.
Dr. Ramesh, if you could respond to that same question, but I just also want to add on a question. I started this panel by saying when we spoke offline, you had said this is a very pertinent question to be talking about the intersection of healthcare, hospitals, hospital care, and technology, and not enough of it is happening. What can change that?
I like to just look at it in a certain perspective. When you talk about tech, and I sat with IT companies and we have built our own tech. we talk about persona of the user. So when you talk about tech, like probably me and him would look at, operational perspective, we have to deal with the manpower, we have to deal with, then there would be somebody who's a different user, who's at like a marketing person who looks at certain elements of that. Then there's a patient persona, so there are different personas. And even when we look at tech building, like for example, ProDoc is looking at certain pain points in terms of who the user is. So today what's happening, I can't talk tech outside healthcare, whatever is my exposures towards healthcare. I think we need to be able to bring together all these personas. Today all of us are so dependent on people. Hospital healthcare is so people dependent, a lot of inconsistencies, a lot of challenges that we have. Ideally speaking, we would love technology to do two things for us: reduce the number of people that we have to deal with, ideally non-clinical to start with, automate things like security, housekeeping, deal with lesser number of people, and also for us to have to deal with lesser variability in the competency of individuals, either nurses or doctors. Even the best doctor at some time may not be at his best. So technology may not exactly replace, probably aid, but at the same time bring in a certain minimum operating criteria or minimum boundary within which, even the doctor at his best, or in a day when he's not at his best, he operates within a certain element of boundaries. So tech, while it's solving certain aspects, tech has to solve the entire flow, or it has to be complete. You can't do for one persona and there's a contradiction to the other persona. Something that me as a CEO or COO needs might not work for somebody who's a doctor, or might not work for the patient. So this is where I see a challenge. Probably this is a global scenario, but an ideal scenario for all of us would be, is there a magic wand where tech comes and then reduces the number of people and keeps people within their optimal level? That would be an ideal scenario. I hope it was more in context to what you asked.
Sure. But
And,
no
yeah,
such magic wand exists right now.
I
at
don't know
least.
if somebody could do that. We would be thankful. Yeah.
Actually, on that note, are there any questions from the audience? Maybe we can take one or two before we take some closing remarks. Any questions? Okay, yeah. Yes, ma'am. Can you please introduce yourself?
I constantly keep getting discouraged from doing this with hospitals because timelines are too long, try to go with smaller clinics. There's a lot of ambiguity for me as just entering this space around who makes the decisions, on the basis of what are those cycles typically like. So could you just give some examples of what are the parameters you look at? Who are the right people within the hospital who take these decisions? Do you already have a set of priorities? So just what does it actually look like? And is it true that it would actually be a very long drawn process, or is that changing?
It's for Sunny, I presume. Yeah.
Yeah, thank you for the question. I totally agree with you in the sense what your sentiments are in terms of when you're trying to build out something. At the builder side, it looks like a great solution, and when you go to the provider, you hit a wall, literally, right? With the legacy players or the larger format ones. That's always going to be the case in terms of decision making is not going to be any faster. Let me say this. Second part is, whom do you sort of get in touch with? I would always recommend get in touch with a business person, somebody who's driving the business, because he may be able to see the value because they are intuitive to think like, okay, what's the ROI I'm going to get out of this initiative? But yeah, the adoption from the smaller format, smaller clinics, which will be much higher because the layers are much lower. It's more like an horizontal system over there. Probably the speed to execution would be much higher. But I think the bottom line lies in the product itself. In terms of what does it speak to me as a provider, I think that needs to be very specific. And you'll also have to see how does it fit into this system. And I think it'll help you also when you do a lot of this idea bouncing with the providers before you actually pitch, because on the other side, you don't really know what they want. I think those conversations really help. That's my take on this.
I mean, as an entrepreneur, there are two things, like how my colleague here is telling. At different times or in different situations, the decision makers are different. It may not be driven by the person at the top. It may be somebody in the ecosystem who drives the decision. You need to find out who that person is And then when you go meet that person, like he said, you need to pitch, understand what the pain points are. The pain points may vary. At that particular time, you get your positioning right, you get the pain point right. Like, for example, like from last 1 month, they're focusing on some audit amount missing, or lost cases, lama dama. There's something that they're struggling with. So there are two things: finding who the decision maker is, and probably an element of luck in getting your timing right in terms of what your pain point is. Right? Just adding, just to
Just to close on that, I think I'll also emphasize on the larger problem which we encounter in these situations is the data management. So obviously the larger players are very worried about their patient data, although you enter into an NDA and all of that. But I think that holds back a lot of these decisions. If we can, I don't know, I'm not the sort of the right person. If the ecosystem can do something about it where the data sharing becomes a lot more transparent, there's a lot of trust built in that. I think a lot of work also needs to be done around that.
Thank you for that question. Maybe time for one more question from the audience before we take closing comments. Yeah, at the back.
Hello. Hi. Bharat Reddy, founder of Perceptor Hedron. I had a question about specifically the human aspect that you described, that you wanted to reduce the number of people in healthcare, ideally. And what we are seeing in most of the AI technologies is like they're gravitating towards decision support systems rather than actual outright replacement of people. So, and that decision support system mainly is geared towards doctors more than nurses, believe me. So, where do you see that going, in your opinion? Do you see healthcare providers at the end of the day being less doctor intensive and more AI stack intensive? Is that something that you're looking at, moving towards?
Yeah, please.
Yeah, so there are two things that is on my head, like as I heard you, articulate your question. One is, what's the future 20, 25 years from now? Probably we see deep tech hospitals. When you talk about AI is just one element of deep tech. The hospitals of the future will not look, feel, and be the way it is today. I can guarantee you that. We have seen a Maruti 800, and we have seen EV cars, and we have seen the transition. The current hospitals were built 20, 30, 40 years back. Okay, there will be a transition. The element of dependency on people, especially doctors, may vary to the extent that there may be a day when it may be independent of a doctor. Okay, 20, 25 years from now, we may see a hospital which doesn't look, feel like the current hospital, and it may not have people in it. That's a futuristic scenario. I think we will head there sooner or later. We have people like Elon Musk out there trying to do a lot of things, so we don't know. The next thing in the current context is we need to know that we have dependency on a lot of people in the system, right from the person who answers the phone to the housekeeping to, so the doctor is so heavily dependent on all these people. No surgeon today, I think Dr. Uma would agree, no surgeon today would step into an OT without their OT matron or without the OT team. They are so dependent. Then how can a doctor step into an ER, step into an OPD, step into an IP without having his team in place? Today, they don't know who is on duty. They have no idea as to what equipment is, what medicines is, and no. Without tech, it's not possible. It's impossible. Forget the day when hospitals may function without doctors. But today, for doctors to function without tech, it can't happen. Tech is an essential. It's not an option. It's not a luxury. It's not a consideration. You have to do it. We have to do it. Okay. No matter how great the team is, no matter how great the management is, I think tech is essential today. It's not an option.
Sure. Just very quickly, could I give the two of you also the opportunity to respond to that question? Is the headline that the healthcare space is going to become less human dependent, or that the roles are just going to start upscaling? I would request for both of you to respond as well. Maybe Dr. Karamveer.
So to that question, I think what Sir said is correct, but if I look at it from a current perspective, a short-term perspective rather, nearer-term perspective, 2, 3 years, 4 years. So before we reach the stage where doctors are replaced or doctors are reduced in terms of their workload, I think it's the support staff around the doctors which gathers data or helps them. Let's say a doctor may have a 5-member team, right? That could reduce to maybe 1 member, and then them doing all that work with the help of agentic AI technologies or other sort of technologies as well. Also, what that does is uniformity of information, because it reduces or removes rather the human error. So what mistakes currently from one person to the other when information flows, what can happen, that would, I think, reduce or fully be eliminated if this technology becomes as robust, in the near future, and then slowly and steadily we adopt it. And then maybe later in the future, that also may percolate down to the doctor layer.
I think nothing more to add. I think technology definitely has a role. Like we said, the core areas might take more time to adopt because of the way it is structured. Obviously, the non-core, non-clinical is ready for disruption, I would say. That. But I think I have just a last bit of a caution in the sense that the way we are getting swayed by this entire AI wave across the board, especially in the healthcare side, I'm saying the West would always be the first adopter, in the sense we will see that wave actually crossing the healthcare in a big way, which is still not seeing that. I think once that wave is done with, you would see things changing here back in India. That's how it has behaved historically.
Sure. Thank you so much for that. I trust it answers your question. I'd like to take quick closing remarks. Maybe Dr. Karunveer, I'll come to you first. You touched upon agentic AI, which is, AI agents, of course, and I think that's a very important point that you brought up. How should the checks and balances be put in place, even as now processes are getting more automated? What should we keep in mind?
So checks and balances from an organization perspective,
Yes.
or from a government compliance perspective?
From an organizational point of view, is there anything that you want to add? Because we're getting more automated, but we cannot lose sight of the guardrails.
See, before all the proper guardrails are put in place, I would say all essential data and essential decision making should not be done through AI channels. At least what I would say is the non-essential stuff, like, as I said, marketing or those kind of things can be taken care of. But where there's important, sensitive information and decision making, then I would stay away from that till the time the ecosystem has evolved to a level where it can sort of handle that.
Sure. Sunny, to you, you were saying that, we'll perhaps see this wave of automation happening in the West, and then it might come to countries like India. One thing that we are yet to see in India, perhaps, is ERP that works across hospitals, that works across states. Looking ahead, maybe next 2, 3, 5 years, do you feel that this is one area that needs immediate and urgent attention, and are you hopeful we could see that?
No, absolutely, yes, because like we discussed earlier, everything is existing there, but it's in silos. They're not able to talk to each other. Interoperability is a problem. Today, a hospital, if they want to just switch their EMR provider, you really have to really think hard, 100 times, so to speak. So there is a case for that in terms of bringing everything together. But I think the discussions like these will help. Probably the guys who are actually building these solutions out there should have a lot more interaction on the provider side. All of us come together on one platform, you actually innovate, or you basically get what really needs to be done. I think these conversations, these forums would really help accelerate that process, in my view.
Sure. Dr. Ramesh, I'd like to give you the last word. You're a serial entrepreneur. You're on your fourth startup, okay? Looking into the next, let's say, short term, what's that one process or one piece of technology that hasn't happened in the last few years that you're hopeful and keen you will see in the next few years?
No, thank you for acknowledging the fact that I'm an entrepreneur. I think as entrepreneurs, we know only one thing: to take risk. I think all entrepreneurs here, I appreciate the fact that you're moved out of your comfort zone, you're taking risks. And for us to succeed as a country, for us to succeed as healthcare, ecosystem, I think we need a lot of entrepreneurs taking risks out there. And what I feel is missing is not on the entrepreneurs or on the tech side. I think it's on the government side. They should let entrepreneurs do things, take risks, probably fail, relearn, and get back, and not be punished for taking risks. So I think what's lacking today, I think, the government is doing a great job. They're putting, a lot of things in place. There is a progress. Last 10 years, we have made significant progress. But the government needs to encourage entrepreneurs to come forward, take risks, and not punish them in case it doesn't work. Okay, help them get back. And for us, trust me, that day will never come when everything falls in place, or we cannot wait for that day to come where everything falls in place to do the transition. We should do it now. Take the risk, move forward, do mistakes. When I'm saying 25 years, where we see a hospital that feels different, it can happen in 2 years or it may happen in 200 years. We don't know. Okay, it depends on a lot of things, and two key factors: entrepreneurs, governments. I think it's all left to these two category of people for making it happen.
Thank you very much for those very candid remarks. To all three of you, a round of applause for our panelists today. Thank you for your time.
Thank you.
Thank you so much for all of you. I request Sunanda to kindly hand over the gifts for our panelists. Thank you so much, Sunanda, and thank you all our panelists for the engaging discussion. Well, ladies and gentlemen, once again, let's give a huge round of applause for all of them. Thank you so much for keeping it very engaging and insightful.